Urinary tract infections, sexually transmitted infections, and even cervical cancer can be prevented by how we take care of our private parts as ladies. In this video, I'll be explaining to you how to go about this. Hi there, I'm Dr. Ayuk. I'm a medical doctor and I do medical educational videos. Point 1. What kind of underwears are we to wear as ladies? It is recommended that we wear cotton-based underwears. This is because the cotton provides free exchange of air between our private parts and the environment. This prevents heat from forming down below and also will prevent bacteria from growing and causing us infections. This takes us to point 2, how to care for our underwears. We should be very careful with the kind of chemicals or soaps we use in washing our underwears and how we rinse it. Because if these chemicals stay in our underwears and we put them on, it can alter the medium of our vagina, thereby causing the normal bacteria that are there to become more aggressive. And this can lead to infections, vaginal infections. So I recommend that you get milder soaps, you wash, and you make sure you rinse very well before drying and reusing. Also too, newly bought underwears should first be washed and rinsed appropriately before being used. Point 3. How to shave and what not to use. So, in order to shave our private area, we have to shave in the direction of the hair growth. That is, if the hair growth is like this, you shave in that direction and not the opposite direction. This is to prevent you wounding yourself first, and also to cause ingrowth of hair or the hair to grow downwards in your private area. Also, as we've seen in the previous point, do not use any chemicals, even if it is written there that you can use it in removing hair from your pubic region. This is because chemicals, when they get into your vagina, they change the pH or the medium of your vagina. So we have healthy bacteria that live in our vagina. So when this medium is being altered, this causes these healthy bacteria that do not cause any infections to become more aggressive, and then it will lead to infections. So you start having offensive vaginal discharges, itching from down below, and you're wondering it is that cream you're using to shave that hair. So do not use any chemicals. Also too, there are some ladies that use chemicals to bleach the area of your pubic region because it's normally darker and they don't want it that way. I'll advise that you don't use such things because it is normal for that area to be as dark as you see it. That is normal. So using bleaching products or any chemicals down there is instead causing more harm than good. This takes us to the 4th point. How to clean when we use the toilet. This is very important. It is recommended that you clean from front to back, whether after having a wee or after having a poo. Clean from front to back. This is simple. It just avoids you taking feces or bacteria from your back passage, that is your anus, and introducing it to the vagina. So we clean from front to back. Point 5. What to do after a sexual intercourse. This point makes me to laugh. All right. Firstly, it is recommended to practice safe sex. When I say safe sex, it means using a barrier during intercourse. This prevents the development of cervical cancer, and also it prevents against sexually transmitted infections and pregnancy, as we all know. So we always advise that after that activity, it is good to go to the toilet and have a wee. This is beneficial in that during the activity, there is lots of heat that is generated in there, and also lots of moisture as well. So this can cause bacteria to easily spread either upwards to the reproductive system or to the bladder. So weeing immediately after that will flush out those bacteria, thereby preventing you from having urinary tract infections and also sexually transmitted infections as well. Point 6. Have a visit to your doctor as a lady at least once every year. This is very, very beneficial because your doctor is going to assess you. Your doctor is going to do some tests to see your overall reproductive health. So I recommend that you see your doctor at least once a year. It is highly recommended. And also too, there is what they call the pap smear, which is a smear. It is just a test that it checks on the health of your cervix. Your cervix is the entrance to your womb, all right, in ladies. So check it out and see if there are any changes going on down there, which could mean the coming of cervical cancer. So if you're sexually active and you're 25 and above, it is recommended that you see your doctor for these tests and you do it routinely. Alright, thank you for watching this video. If you like this video, of course, just give us a like. And if you want me to do any video about any health challenge or any health condition that you really want to know more about, just write it in the comment section and I'll be doing that for you for free. Also too, I'll be doing a video on vaginal discharges, okay? The normal vaginal, what is normal and what is abnormal and how to go about it. Thank you for watching and be good and bye.